Today in Independent India, I'm here to talk about few tips to get a freedom from the burden of asthma in our lives. Each day we are seeing more and more asthmatics coming to us, more and more children, adults, and elderly coming to us with symptoms suggestive of asthma. And this is happening because of the ever changing environmental scene around us, the increase in allergies, the post infective periods, and so on and so forth. So it's important for us to address this issue and know about it and know what an asthmatic must do to keep himself healthy, hale, and hearty. And though while I may not promise you a freedom from asthma disease, I can promise you a freedom from the deliberating signs and symptoms of asthma. Asthma is highly misunderstood. People feel that asthma is limited only to those who had it as a child. But late onset asthma, asthma in elderly, asthma in special comorbidities, asthma in obese is equally important. And asthma in children is very troublesome. Symptoms of asthma may not always be the breathlessness. You may not always get the symptoms of heavy panting of breath when you get an asthmatic attack. It may just come in the form of recurrent allergies, allergic rhinitis, a cough that doesn't go, a cough that gives a wheezing sound, a sound of whistling coming from the chest, or feeling tight or choked in your chest, along with breathlessness. There are a lot of triggers of asthma, and asthma is essentially an allergic disease to start with. So there is something that will always trigger it. It could be a season change, it could be dust around us, the dust mites in your rags, curtains, mattresses, pillowcases, the fragrances that are used by people around you, or any strong smell of oil, petrol, kerosene, mold, sealant, and fungus in and around you, and even your dear pets at home, with dogs and cats and birds being very common allergens. So there could be a lot of triggers, both in the air that you breathe and sometimes also in the food that you eat, that could trigger an allergic response and cause asthma attacks. So you have to be mindful of your triggers because that's what will guide the final treatment of your asthma. Asthmatics often fear taking multiple inhalers. They fear taking steroid tablets and injections. They find it difficult to handle taking medicines on a day-to-day basis, and they feel that telling others about their asthma is a big social stigma. So I would like to tell you that while you do not fear away from wearing your spectacles, checking your blood sugar and blood pressure, there is no way of you can fear from letting others know about asthma. Tell your peers and colleagues that you have asthma so that they can be of support to you when you need it the most. And do not shy away from taking inhalers because inhalers are meant to treat and control your symptoms. Today, as we embark on this day, let's stand against asthma and let's take very simple basic steps that can prove beneficial to you, and you can lead an absolutely normal life without any limitations because of asthma. Remember to take your inhalers. Inhalers are the right kind of medication for asthma. Whether you take MDI inhalers or pressurized inhalers, or you take dry powder inhalers, or you're taking nebulizers, they're all different modes and means of taking inhalational medication. The final product is the medicine going deep in the lungs without causing side effects in your entire body. The second step is that your inhaler should be used in the right way. A lot of my patients come up to me and tell me they have been on inhalers, but it never ever helps. And mostly we find that the technique that they use is not correct. Be sure to check that your technique is correct. Even if you've used it for tens of years, you could still be wrong. Get it corrected by your doctor. See videos online. Make sure you stay updated to the newer types of inhalers, and you can control your asthma with the same medication, but in a better way. Also remember that triggers trigger asthma. So you should know your triggers and you should prevent those triggers. Keeping a pet by your side when you know that you are allergic to the pet is not a good idea. So always make sure to identify the cause of your attacks and to prevent them. Plan your actions well. And now All doctors encourage their patients to know their asthma action plan. Ask your doctor to write one for you. This will tell you what to do when your symptoms worsen, which medicine to take as an emergency aid, and which medicines not to over rely on. There are people who take tens and twelves of puffs of the same medicine hoping for relief, while that medicine is no longer recommended. The short acting, quick reliever medications may not work, and you may have to switch to maintenance medication. Talk to your doctor about it. Also, stay active, eat well, manage your stress. These are certain hidden triggers of asthma that may get overlooked. And if you take care of them, you may be able to protect yourself better. Keep track of your symptoms. You can use certain aids such as the diaries or the pockets or e-diaries to maintain data on how your symptoms are. You should use a peak flow meter to know about your lung function and keep measuring. Do spirometries or lung function tests at regular interval so that your doctor knows what your asthma control is. With all that in mind, I'm sure we will get freedom from the symptoms and signs of asthma. And as we progress into a new day, let's also go ahead with a new day in the life of asthmatics. Thank you and wish you all a wonderful Independence Day ahead. Thank you.